Hi, I'm Harris Harrington of depersonalizationrecovery.com. The topic of this video is, should you see a therapist if you suffer from depersonalization disorder? This is a tricky question because there are as many different therapists as there are different personalities, different people, and different theoretical backgrounds. If you have depersonalization disorder and you want to see a therapist, you need to keep a few things in mind. First, there's personal compatibility. So, irrespective of their background and their bias, is how personally compatible are you with this person? Do you jive well? Do you get along? Do you really feel like there's a sort of emotional resonance between the two of you? That's a really important issue, is just personal compatibility. Then, it's their theoretical background. Are they cognitive behavioral therapists? Do they have a Freudian bias? Are they into Jungian psychology? Are they attachment focused? What's their specialty? But before we go on to specialty, it's really what is their kind of framework? Now, I really think attachment therapists can be some of the best, but then again, it really comes down to how personally compatible you are with people. Now, I think the best approach is someone who has an integrative approach, someone who kind of sees the utility in cognitive behavioral therapy, someone who sees the utility in psychodynamic therapy, or processing the past and seeing how your family issues lead to your current problems. It's someone who really draws from a lot of different areas, and they're going to have to be really good. And also, you want to find a therapist that actually knows about depersonalization disorder or knows about dissociation, understands trauma-related disorders, maybe post-traumatic stress disorder, someone who has experience, a lot of experience. And there aren't that many people that know about depersonalization disorder. A lot of therapists just don't know. And, it's just really too bad, because it's in the DSM, and everyone, to get a degree, you've got to read the DSM to get your degree. I don't know if they were snoozing the day that they were going over depersonalization in class or what happened, but a lot of therapists don't even know what depersonalization disorder is. So you might actually have to tell them something about it, but even then, once you're starting there, it's kind of a bad spot. If they understand dissociative disorders in general and how they're caused by trauma, then that's a good place. Then, of course, there's psychiatrists. Psychiatrists have medical degrees, and they can prescribe you medications. There's no medications that cure depersonalization, and there isn't really good evidence that there's anything that really comes close. So, of course, I'm not allowed to give you medical advice and all of that, but for the most part, there's no medication that helps you get over DP. Now, a psychiatrist is going to be very keen to prescribe you multiple medications immediately. That's what they do, okay? They're the distribution channel for medications. That's how it works, and it's a billion, trillion-dollar industry. And I'm not saying that a medication can't help you at all, but there's usually huge side effects. And when you're in that office with a psychiatrist and he's got that degree and he's so smart and there's all those books on his shelf or whatever, you might feel, well, I'll just do it because he says so. And I'm telling you, there's just horror stories of people that have taken medications that actually make their depersonalization worse. In fact, a lot of people get depersonalization through taking a medication, having a panic attack, and then having to go through some hellish withdrawal from that medication. So a psychiatrist might not even be good for you either. If you watch the movie Numb, written and directed by Harris Goldberg, that's really it really paints kind of a funny but true picture of the therapy situation. The character Hudson goes to all these different therapists to try to get over depersonalization, and has all these experiences, and they kind of are negative. And this is just one of the most common things that people with depersonalization have to deal with, is therapists that don't know what they're dealing with, But it's really a tricky question. I mean, I think if you've never had anyone to talk to about depersonalization, and you have basically no social contacts, then you should go to therapy just for a little bit. But make sure you have some health insurance, because it can get kind of expensive, or it's paid for partially through your work. You know, a lot of times health insurance can be a really good plan. It can cover a lot of the sessions, because it can be very expensive and you might not actually be able to afford it. So it's sad, but it's a fact. So finding a therapist, it's very tricky. They can help, because if you have someone to talk to, you can process your pain, and if they really attune to you emotionally, it may not even matter if they know a lot, you know, but if they're there, then it can be good. One problem I have with therapists is that it's kind of a one-way street. You're telling them all your problems, but you kind of don't know who you're talking to a lot of times, which is kind of weird. Whereas if you have just a friend, you can talk to them, they can tell you their story, you know, you can kind of have a sharing of your life experiences, and I like that. I like that. Whereas going to a therapist, it's weird. And then when the 50 minutes are over, it's like you can be talking about something so emotional to you, so deep, and then it's like, oh, time's up, and you gotta go. And it's just weird. It's artificial. Therapy is an artificial relationship with someone that you're paying to listen to and help you, and there's nothing wrong with that, but it is strange. It has its downsides. Another thing I'll mention about therapy is that if you're not really getting anywhere, you know, within a certain time frame, and you really have a feeling this isn't a good fit for you, you might want to switch therapists or just stop going to therapy altogether. You know, I don't think depersonalization needs to take years of therapy to get over. You can do a lot, definitely in 6 months. You know, especially if you have, like, you read some of the books I recommend, if you try my program, my articles, my videos. I mean, there's so much information that I have. If you go into therapy and you combine it with what I'm telling you, your results are going to be better than if you just go to therapy and you never think outside your sessions. That's why it's so important to journal, to process your past, to work on the way you think. Improving your life outside the session is vital to improving if you go to therapy. So don't just go to therapy and hope that just the session is going to get you over DP. You know, it's really important to do everything outside of the session. You know, and you can use my program with therapy. I mean, I've had therapists, you know, email me with questions, and I've had therapists that talk about how they're using their program with their clients. So it's really something that you can use with a therapist. So I highly recommend that, to combine both methods. So I hope this video helps you in this, you know, kind of tough topic of should you go to a therapist. I also have an article about it on my website. Check that out. Subscribe to this video and subscribe to my YouTube channel for much more videos to come, and I hope that was helpful.